Hello.
No.
Yeah! You made it.
You made it.
Oh, thank you, Jesus. Okay.
You want to try the video or leave it like that?
One step at a time, baby step, baby step.
Yeah. Oh, there it is.
Okay, good. Okay, good morning, everybody.
Good morning.
Yes, I'm excited. At least we get the two prayers that we need to put together, so that's great. We have a couple of people who may join in, who usually will help with the logistics stuff. But let's just start things that Dr. Redempta can help to give us the picture in Tanzania, and then Dr. Venessa can ask the questions to help in planning and preparing for this vision screening project. So I'm just gonna give a little bit of introduction. I know this is the first time for all four of us to meet. So my name is Dr. Harriet Gabone, and President, CEO, and founder of Dr. Gabone QHSC. So we do medical mission every year. And then so this year, the first time to include the vision screening. And thank you for Dr. Venessa to join us and come and provide this vision screening for the kids at Nazini Primary School. And then also, if we should be able to get an opportunity to come to you guys' office and then be able to see patients who are there and share her expertise and learn from you guys. So that's the goal. And then I'm going to give you more details after everybody introduce themselves. So I am so excited. At least I get to hear answers. So for Dr. Venessa, I can start get going. Okay, thank you. Mr. Parag,
I'll be brief. My name is Parag, and I'm the Vice President for QHSC. And I try to help out with logistics, operations, anything. And I won't hold this meeting up.
Thank you. Dr. Venessa?
Hi, Redempta. I'm so sorry I can't put on my picture. I'm just feeding and taking care of my mom, and I have a mask on anyway, so you wouldn't even be able to see me fully. But so I'm a licensed optometrist here in America, in a couple of states. I'm licensed in a couple of states. Been practicing, May makes it 30 years, and just love doing mission trips and being able to help others. My motto is, helping people see the world clearly and helping people to be able to see God even better. So hopefully I could I'll be able to do those two things when we come to Tanzania with your help.
Thank you, Dr. Venessa. Dr. Redempta?
Good morning, everyone.
Good morning.
I'm Redempta, Optometrist at Muhimbili National Hospital. I've been working there in the pediatric department for more than 8 years now. So I'm telling Dr. Venessa, I have good enough experience in pediatric, and I'll share with her everything what we are doing as Muhimbili National Hospital to see how we can help other kids to get what they need, because there are some of kids, they are in school, it's difficult for them to come to the hospital to know they have a problem, but if we go there, we can screen them, then to find if they need maybe spectacle or other management about eye, so we can help them to manage. So that's all.
Thank you very much. I'm so excited. The last statement you said that you go to where the kids are, and that's exactly what we, Dr. Venessa, do. Go to the community and find out, because those kids will never come to the your office and say, oh, I have vision problem. And most of the time, that probably the teacher identify them because the child is struggling, or he can't read, or she can't do this. And then by the time you realize the grades are continuing, the child is failing or something like that. So we are so excited. And that's why I wanted that if you guys have time, if possible, to join Dr. Venessa when she goes to the school, and then screen all these kids, and then children who needs more attention, then we can make at least that connection that they can come to your office. I know we discussed on the side, and you said you might talk to your superior and discuss what the possibility and what things we need to do ahead of time, which I appreciate that.
Yeah,
so
it's true.
Yes, so I'm going to give you just a little brief about the school, and then I will let discuss. So at least when you're answering this question, at least you can give Dr. Venessa an idea. So this school has 774 kids as of now, but they're doing registration for more kids, like that's our one. So we're planning for 800, because just in case they get more kids, at least we are prepared for it. So because we knew for sure Dr. Venessa is not going to be able to see all 800 kids and in 8 days, because our mission is 2 weeks, so minus weekend. So that leaves us with 10 days, but at least 8 days for seeing the kids. So for the hospital, for the school, we expect at least for her to be there all 5 days. It depends on like every other day or every day, depends on what we're going to discuss afterwards and the logistic part. So at least 5 days for the school. And then the other 3 or 4, it depends if she can come to the office. So at school, we are hoping that the teacher would identify the children who are at risk, or they already have vision impaired, or whatever the diagnosis is. I don't believe that the physician is the one who gave that diagnosis. I'm not sure, but I think the teacher gave her from the students struggling or failing grades or can't read, complain of eye itching and stuff like that. So there's like 35 students who have been identified already, and as well the ones that we want Dr. Venessa to start with, because if they're already identified, then she needs to pinpoint if it's something that you screen for, give the glasses, or if they say spectacles, give them that, or they need more attention, medication and surgery or whatever it is. So at least we want them to get the right diagnosis. And then so from there, because we know 800 kids, having 35 at risk, definitely those math don't work. It's more than those kids, there's more kids who are affected, but they've not been identified or diagnosed for that. So to address that, we have Dr. Venessa and the team, which she's gonna be working with, we're gonna do the visual screening. So she will have people who are doing visual screening while she's seeing those children at risk. And then to be able to identify more kids who are at risk or near risk, or like problem with vision, but nobody have told them that. So if we identify more kids who are at risk, then Dr. Venessa, and if you guys are there, then you can help screen even more to identify, is it really at risk, or is it maybe nutrition? Is it because of other disease process that are affecting the eye, or what exactly it is? And if we are we are able and blessed, we can help those kids who are needing further treatment when they come to your office. So that's the part which we have. The logistic comes like, how is she going to see these kids? What equipment does she need from the Tanzania standpoint to be able to go and do screen the kids? Because you guys have done going to the clinic, to the school or to the community. So you know at least what are the portable equipment that's going to be efficient for her to do her work. And if those equipment possibly can be found in Tanzania, or does she need to bring them from here? So that's the part which we need to figure out. So I'm gonna let you just answer that and tell us how you do when you go to the community or schools, things that you do, so at least give paint a picture for Dr. Venessa, and then Dr. Venessa will be able to answer those questions.
Okay. For us, while we are doing community service, we go with talking about the community screening.
Okay.
For here, we need equipment, because in the hospital, I think it will be difficult to take equipment to the screening. So maybe I can mention the equipment that we need.
Okay.
Is it right?
Yes.
So what do they do when they
say whatever you are using right now when you go to community, to the schools? Like what equipment do you use, and which one is more efficient to do the screening?
Yeah, we use a trial case retinoscope. Trial case, the one which will help us to do refraction. Retinoscope, dilating drop, cyclopentolate. Okay. Testing VHRT, Snellen 1.
Okay.
Yeah, that's a preliminary thing.
So you bring the chart. You said a retinoscope. Do you have a portable auto refractor?
No, we don't have.
Okay. And you say the meds cyclopentolate, so you do a cyclopedic exam if you need.
For small kids.
For the small ones. Okay.
Yes.
So normally when you go out and you're doing the exam in the community, how long does it take to do each kid?
10 minutes, 15. It depends the case. If they have a problem, can take 10 minutes up to 15 minutes. Yeah.
Now, so when you're doing the health of the eye, you're doing, you have an ophthalmoscope. Do you check the back of their eyes, or you're just doing vision, the vision test for spectacles?
We do just vision for spectacle. We go with the ophthalmologist. They can do ophthalmoscope. Then for us, we can deal with the VA refraction and other things, because it's for one optometry to do refraction of ophthalmoscope. Sometimes it takes more time.
That's of course. That was my main thing. I'm trying to see what is it that you do, because same thing. When I go on the mission trips, I just do the vision part. If there's ocular health problems, I'm not able to handle that. So it's just the vision for the glasses. And that's what I wanted to find out for the children.
Yeah.
Is that what we're doing? Because if we do any more than that, if I do the full exam, we maybe be able to see 20 children for the day. And that's it.
Yeah.
In an 8-hour day.
Yeah. For screening, we are not doing the ophthalmoscope, fundoscope.
Okay.
Because it's difficult to do for both of them. If we are worried with them, we can send to the hospital for further management.
Okay.
Yeah.
Okay. So it's just the vision. We'll check the vision and get the spectacles and to look in the back of the eye. If we think there's a problem because of the vision, we're not able to get them to 20/20, then we refer them over to the clinic to see the ophthalmologist.
Yes.
Okay. Very good. So that's good. That's the first word. Dr. Harriet, what are the hours we're looking at to work in the clinic's working day? How many hours?
The clinic?
You mean the clinic? The school?
Just in the school or the clinic. What are the working hours? Is it 9 to 5? Is it 8? Like how many hours are we going to be in the field working?
So for school, I know the school usually the student gets at 6 in the classes. I mean, they have a assembly at 7 o'clock. I believe 7:30 to 2 o'clock. That's what they have. I think the first grade and second grade ends, I believe, at 12. I mean, I have to check it again.
12 or 11.
Yeah, before lunch. And then the 3rd to the 7th grade, yes, it starts at 7:30 and then end at 2.
Okay. Very well. Just trying to get an idea of what we're looking at. Okay. That's a big help. That was the main thing that I needed, because where I've done missions, we didn't concentrate a lot just on kids. It was, a mixture, and I just wanted to see what they were expecting of us. Now, Dr. Redempta, will you be able to help with the school?
Yes.
Okay, good. So at least it would be 2 of us. Is that it, Dr. Harriet?
Yes, if we can get more, we're going to work on get more people. Yes. We're going to
try. There's a nurse or two, I think, that really high-speed nurses that are going to be working with you too.
Yeah, so I mean, we're going to get more activity. Yeah, yes, that's what I said. I'm glad, Dr. Venessa, you mentioned, you gave at least a reference of how many, because that was my next thing. When Dr. Redempta said you can see at least one child in 15 minutes. So yes, we are hoping that nobody has not many have too much disease process that it will take half an hour. So if we gain every child is 20 minutes, because the child have to make sure you tell them and you have to translate or whatever. So let's plan every child is 20 minutes. So the first probably a day or two, Dr. Venessa, you're more likely going to see those people already identified at risk. So that because it's 35. And then so by that time, it will give us the rest of the team to do the visual acuity to try and sort out who is. So by the time it's day 2 to go day 3, you're going to start seeing people who have been identified while we're there. And that's what I wanted to have in my head, because logistically, I need to know how many people you need. When you're doing your children who are identified already, so we can start doing visual acuity and start giving you, if we find any more kids.
Okay. Very well. Yeah. That flows. And
so at least
I could see that going through.
I'm sorry, go ahead.
I think that with the 20 minutes is good because we also have the dispensary, so which my husband doesn't know yet, but he'll be running the dispensary. To be able to give out the glass, he's going to work. He's not sitting back.
Vanessa.
Daniel. Yeah. So he's going to operate.
I'm sorry, you go ahead and continue. I'll wait till you finish.
The dispensary with the glasses, because he's done that before. So, you know, after they finish with me, they go over to the dispensary and he'll help them pick out their glasses and that. So that should, you know, the exam and the dispensary thing, should be 20 minutes. I think that's a safe bet for 20 minutes.
Yes.
So and I was going to say, I think, and Harriet can probably talk to this better. I think we have a nurse or two that are going to work with you, but there's also a possibility that there'll be more people helping. They may not be healthcare workers, or they may not be healthcare workers, but they'll be able to assist you. I don't know. Do you think we could maybe get one of the 6th graders or somebody to maybe help? I'm not sure.
No, we're gonna have more volunteers so we can be more efficient. And we're gonna get volunteers who may not be medical people, yes, but I want to have
but they don't need to be medical.
Yes, I wanted 3 nurses because one of you, I mean, each one of you have an actual nurse working with you, so for, you know, efficiency purposes. And then other than nurses coming from America or from Tanzania, but they're efficient. And then you get another nurse who can work with people who are non-medical to try and do the visual acuity and get those things going. So definitely we do. So as of now, I have 2 nurses. So we're gonna get another one.
Okay, good.
And then get more logistic people, so like 4 more people. So at least you have 7 people. When I count the number, I don't count the 2 of you. The doctor gonna be working, so we need a team to help. We will support you. So yeah.
Okay, very good. Very good. Okay, okay. That was my main concern. What were we expected to do, time frame and so forth. Now I'm gonna still bring my equipment, because I do have equipment. I do have an auto refractor, and I actually have 2 of them. I borrow one and I have my own. So, you know, Dr. Redempta, I can show you how to use the, but you probably faster on your retina scope because you're used to using that, but I'll bring the second one. I still bring my ophthalmoscope. I have a trial lens kit that, you know, my trial lenses that I bring, and the glasses. So I do have a portable, little portable slit lamp that I'll bring too, just in case. So I have a lot of portable stuff that I'll bring, and anything that I can get extra, I will. And that's about it.
Dr. Redempta, thank you, Dr. Vanessa. Dr. Redempta, is there anything that from the list of Dr. Vanessa, is there anything that you think she will need to bring in order to be, you know, like supportive of what she have? Or is there anything that you think you might be able to bring from your office to come and supplement that? So we just want to make sure towards the end, we're going to list all those names so we make sure clearance, so we know we can bring in and take back whatever we need to take back. We have to clear that before we get there. So we need a list of all those equipment, but right now I'm just excited that things are growing and we identify things that we need to bring. Yeah.
So did you ask Dr. Redempta a question? Or?
Yes, I did.
All right. Because she's still muted, so. Oh.
Okay, Dr. Harriet.
Yes.
The list of equipment I had from Dr. Vanessa, it's enough, nothing to add.
Okay.
Maybe if I can ask, how about if they need a spectacle? If the kids need a prescription for spectacle, would you provide for them or they have to go to buy?
Dr. Vanessa, that's your question. I mean, I know the answer, but I want to answer. Did you hear what she said, Dr. Vanessa?
Sorry. Yes, I did, Dr. Redempta. I will be providing the glasses. I'm working on getting, you know, normally the group that I work with would volunteer glasses. So I'm trying to make sure that we have enough children's glasses. That's the only thing, to see if I can get smaller size frames. But I will be providing the glasses.
Okay.
Yes.
So they don't need a prescription?
So once how it should go is once we finish examining them, I usually have a little piece of paper, put their prescription on, and then send it over to my husband, which will be handling the dispensary area, and he will know, you know, what number, you know, prescription, and, you know, try to match it with the size of the child and make sure it fits them properly. In between there, we may have to like adjust the frames a little bit, and so forth, but I'm going to be working on trying to get to some of the smaller, because I think we're doing mostly the children, right, while I'm there?
Yes. Yes.
Would you have any idea about, I know you said we're going to the clinic, but I'm spending about how long at the clinic? So it's mostly like
So
one day or something at the clinic?
No, I believe 2 to 3 days. So Dr. Redempta is going to ask the supervisor, you know, like to make sure if they can accommodate, and if they accommodate, what do they need from us? And then, so you'll be able to go there. So I'm thinking 2 to 3 days, but also depends on, because at least now he gave me the number so I can calculate quickly how many days, but I know for sure, at least at school, definitely at least 5 days. So as we get close, we're gonna know maybe school 6 days, and then the other 3 days will be at the clinic.
Okay, so I have to be able to know how many glasses. That's gonna be my thing in the sizes, because we really never did much of the children, but I'm gonna speak to the people that that's donating the glasses and see what they can do, because it's a size that we're looking at, the children's glasses. That's always an issue, because people can't, I don't have any donation of children's glasses, because children don't, you know, they break their glasses, they don't get to donate them. So that will be my issue, but I'll work on that. Okay.
Okay. So I mean, just a quick math, if it's 20 minutes per child and you are there, I'm just giving roughly time, maybe 5 hours. So that's 20 minutes per child. So almost 15, 20 kids per day, and then 5 days, 100. So more than 100. If you aim for 150, 200, that would be perfect.
Okay.
You might be very speedy on doing it. Of course, in fact, that is only one person though, because there's 2 of you. Thank you, Dr. Redempta.
Right, and that has nothing to do with the acuity test, right? That's just
that is just the eyeglasses.
The referred students. Okay.
Yeah,
that sounds like a good number.
So 200 to 300 for 2 of you, then yes. Not everybody's gonna need glasses, but they might need more glasses.
But yes.
So I think if we aim for 200 to 300, that'll be better. If we get more, that's good.
Yeah, that's I will speak with them and find out what's the maximum we can get from them. Okay.
Yeah. I was going to ask too, Dr. Redempta and Dr. Venessa. I'm setting up the project management section for Vision. Are there any kind of like benchmarks or goals that you want to put in there that we need to look at prior to us going to Tanzania?
Nothing that I see, because it's not like we're doing, I know some of the other departments are doing training before and sending videos. We're not doing any of that. Basically for us, everything that that we need, we're coming with, or we're doing our training when we're there. So really not, really nothing that I could think of that we would really need to put in there. Dr. Redempta, I'm sorry, 1 second before I forget, because I meant to ask her, would you have access to vision charts? I know I have some, but we may, depending on how many stations we make, we may need some more vision charts. Would you be able to get about 2 or 3?
Yes. Yeah, we can have 3 is enough.
3 should be, yeah. And I have a couple. So yeah.
If
what I would like to do is,
if we have a nurse to help us to take the visual acutes, 2 nurses and the 2 for us.
Yeah.
Can you do this? Yeah.
Yeah.
Yes, definitely.
Yeah,
you get the nurses and then yes. So that'll be total of 4 then. Okay.
Okay. I'm sorry, Pancho, you can go.
Oh no, I was going to say, so what I'm going to just put in the management group, and like I told you, maybe one day we'll get together. I'll help you to get in there so you can go, and you don't really need it like you said, but what I will put in there is just, I don't even know how to phrase it, because we usually say fundraising, but I guess I'll just say getting glasses, because we want to make sure that we're reaching our goal with the glasses. And unless you feel like it's something that you know you can accomplish, we'll still put it in there. But that way we know if it's getting closer and you're having a bit of difficulty getting children's glasses, maybe a few of us can kind of jump in and try to help from wherever we are to get some more glasses so we can reach that goal.
Okay.
And if you think of anything else that comes up that may be needed, just let us know, or we could try to find a way of getting it. I don't know if there's, because I know like we might bring sanitizer or mask and stuff like that. I'm not sure if there's any other extra little types of materials that you might need throughout your exam process when you're dealing with so many kids.
Yeah, things like alcohol pads is one of the main ones. Yeah, and hand sanitizers. Usually the group that we come, you know, they have hand sanitizers, alcohol pads that they bring for, you know, for the medical. So we would need that.
Okay, so I have a list. If Mr. Branca, you want to add this? Yeah, so I had a list for vision. Our group is, we need those acuity charts. And to me on my list, I had 7, but if 5 would be fine, that's okay. We can have extras, that's okay. Can we get those,
extras always good.
Yeah, can we get those visual acuity chart from like Amazon or anything else like that? Dr. Venessa,
yes, you can.
Okay.
Yes, you can. You can get it from Amazon.
Yeah, because I'm thinking 800 in my head. I need to have for 8 days.
We need to have at least,
10.
If we could have at least 5 stations that they're doing vision acuity. And then, as you said, and then the 2 of us would need a chart. So you would need to run at least 5 different stations. So they would need 5 charts and we would need 2. So yeah, 7 is good. Hold on 1 second. Let me see how many I have that's in condition, because they get so messed up when you're on these trips. And hold on, let me just check, because I have actually taken out some stuff in my office. So I'm just, while we're talking, I'm just check and see how many I have left.
Yeah, so then most of the time when we have, I mean, you guys have identified those things. If you can help me by taking pictures of those, because I want to be able to, you know, to create a little commercial to advertise this, because we want to also get funds. For me, on the vision, I had the goals are supposed to be at least glasses 300. I know 200 to 300, I always go to the highest number so we get as much. And then identify equipment. So all the lists that you guys have identified, can you put them in the list? I mean, just later on. So then we have, when we have a section for vision, then we have all those things. We know these are the things that we are coming with. This is what Dr. Redempta may bring. And then so we know for sure we can be accountable for everything that goes on.
You know,
and then also,
I don't even think you need charts, because I still have a lot of charts.
Okay, so no charts.
Yeah, because what we did in some places, we actually made copies of the charts, and they're still in pretty good condition.
Okay, so no charts. Okay.
So yeah, we're good. We have a couple of different types of charts for the little ones, for big ones. Yeah, I think we're good.
Okay. So then whenever you get a chance, if I can get a picture of those, because as I said, when we are advertising specific for vision and we need the help, and we need glasses for the kids, children glasses. So then we want to be able to say, this is what we want to do. Dr. Venessa, Dr. Redempta are going to be doing A, B, C, D. Can you help us? So all the funds that they give us, I put it here also for, sanitizer, alcohol pads. I had something that says scribbled, I don't know. And then, of course, we are going to do probably 1 or 2 training before we get there. So once we get the team, that's going to be probably in close to June or July. Once we get the team, like a full team for the vision, then yes, we want to be able to have the same meeting like this. I don't mean that we're not going to have in between. I'm just talking about for training. So that time, so people will have exactly to make sure it's going to run like an oil machine. So we're going to have 2 sections where Dr. Venessa and Dr. Redempta are sitting. We are going to have the nurses, and then we have the dispensing section. Then he's going to have another helper there. And then we have the acuity section, people who are doing the acuity. So we have to be able to tell them they need to know when they get there, they're dealing with vision. I'm not talking about the education for the kids. Those are another group. So that's why we're going to make sure everybody knows their team. And then we itemize things, and then so everybody can have what they need, definitely. I usually put gloves there too, just in case if the child comes with, like drainage and stuff, we help them clean up with stuff. So protecting ourselves, protecting the kids also. So that'll be good.
Oh, quick question. Now, you're reading your list to me, Harriet, but also I just want to ask real quick, who's the second nurse? I can't remember the name right now. I know you had Tamasha and
there was Vivin, but yeah, I'm going to have more nurses. There's another nurse who she's going to confirm to me today. So I'm going to update. Yeah, so I'm going to add another nurse there. Yeah.
All right.
But there'll be 3 nurses and then other non-healthcare professional for them. So then they can help us running around to do other stuff. Yeah.
Okay. And then you were giving me your list.
Yeah. I can send you on the text, probably will be easier, then you can just copy and paste. But yeah, I was saying grasses at least 300. We're going to get a list for the equipment from both of the doctors. And then visual acuity will be 7 of them. We need to get that. And then 2 training for the people. And then the, like a PPE stuff, extra stuff we have.
You said 2 training?
Training for the people who are going to be supporting Dr. Venessa and Dr. Redempta.
Oh,
like training sessions.
Those are prior to, right? Or at least a brief.
Prior to, yes. Because by then we get there, we're not going to start teaching in that morning. No, we're going to start working.
Okay, I got it. So we got 5 vision acuity stations, at least 7 charts. Venessa says she has a ton of them. And then we just have to.
So we just put it in there so to make sure we check off the boxes to make sure we have what we need.
9, 10, 11. I have 12 of the big charts. I only have 3 of the near charts. So if Dr. Redempta can get the maybe 2 more of the we need a few more of the small ones. I don't have the near ones. I have the far ones, but the near ones I'll need some more of those. So I'll take a picture of both the big charts, but the big charts we're good. The distance one, I think we have enough. Is the near ones we're going to need. Dr. Redempta, do you have, I'm sure when you go to the community, you have some near charts. How much will you have access to?
Yes. I think I can take it from the hospital. I can borrow from the hospital.
Okay.
Okay, good. Yeah, because that makes sense. Because if we don't have to buy things that we already have, that saves money for other things. So
agree.
We're good with charts then.
Okay, perfect.
Okay.
So from both of you, what else do you think we need to organize early on? Because we're going to start probably the end of this month, we're going to start sending information specific for vision. We need this and this and this. So we need funds, of course, to buy those PPE and extra stuff. And then if there's something that you guys think will make your job a little bit more efficient, we need to get it. So it'd be nice if we know now.
I don't see anything. I think the equipment is the most important thing, which I have. And you know what we may need now that I'm thinking? Occluders. Dr. Redempta, do you have, well, I guess we could make, occluders is what you use to cover the eye. I mean, I really don't want you to spend that much money.
Oh, right. I can take it from the hospital. And if we have some, we can come with it, and I can come with some.
Okay.
Okay, and I think I have maybe 2. But yeah, that would be the only other thing. And as I said, what our department, we're trying not to have you spend any money, spend it in the other departments, because I think we all cover it. We really.
Okay.
And don't forget the trial frame. Didn't mention.
The trial frame.
Yes, yes.
I bought some from Amazon, so I have like about 4 or 5.
Okay.
Yeah, and I have my trial lens kit, so I'll bring all of the trial frames. Okay, that I have. Yeah. Thank you. What else? What else am I thinking about? Shipping. Well, my stuff, I'm going to bring my all my portable stuff. I just make it easy that way, so that I bring my knapsack with all my stuff, so that we don't have to worry about shipping.
Okay.
Yeah, I think that
everybody who is traveling, we get a ticket that allows us to be 2 50-pound suitcases. So you can have one for personal things and then another one for equipment. And then if some people, it's only 2 weeks, so we don't need that much. So probably another, full suitcase of all the equipment, and then plus half. And then if there's 2 of you, then you can have 150 pounds we shed. And then, so there's so many things that we can do. And yeah, so, and if there's some, I know you don't want to ship anything else. If there's something that we can take with us, that's okay.
I'll take my portable.
If there's any equipment that we need to take with us, and then maybe my second suitcase can be shipped, that's okay. We can plan out, as we start getting close to, we want to be able to ship stuff by June. So by then, if we've already collected stuff, we need to send it. And then the worst case scenario, then we have to go with them.
Okay, no, I'll go with mine. Yeah, that's no problem.
Okay.
Our packing thing. You said our trip is from just give me the dates again. Let me put it in my calendar.
September 12th through the 24th, I believe it is, right?
Yes, 12 that's starting working. So chances we're going to travel the 11th, getting the 12 and start working.
Okay, so the 11th. Okay, I have it right. So the 24th. Yes. We leave the 24th.
Yes.
Okay.
Unless you want to stay for a wedding. No, there's a wedding, family wedding, but if you have extra days, that's for people who want to stay extra. But yeah, majority of people, and it depends on the flight that we are taking, either that Friday or that Saturday coming back, yes.
Okay.
And since like we were in Dar es Salaam, so usually the flights leave at night, so we can have during the day, either whatever sightseeing and something, and then at night, 11 o'clock at night, we board the flight and leave.
Okay.
Yeah.
Okay. Okay, very good. Okay. I'm gonna work on today calling the gentleman who normally donates the glasses, and I'll start reviewing, going through that.
Okay. So do you want me to announce also like a donation of child glasses if people have some? You said it.
Not yet, because what happens is I do have a lot of donated adult glasses. It's the kids' glasses. So hold off on doing that. I will start working on and see it, and I'll give you the update on how many I'm able so far to get. That's what I'll do over the next month or so.
Okay.
Yeah.
Perfect.
Excellent. So first team online. How's that?
I know. I'm so excited. I'm so
minor
excited.
to-dos.
I know. I'm so excited that Dr. Redempta and Dr. Venessa met and we discussed, because all these things, it makes sense that I can see in my head now, I hear people are talking, and it just makes me so excited. And if we can do this for these kids, unfortunately, Dr. Redempta knows. Most of them have never seen a doctor who does a vision check on them. So this will be a very, very blessing things to do. So
you're welcome. One more question, Dr. Redempta. It may sound weird, because when I go to different places and do mission trips, you realize that, hear me?
Yes.
What is your, just to give an average, do you have a lot of nearsighted kids? Give me a rough estimate when you do your exam. What you say is your percentage of nearsighted kids?
Well, she's muted now.
what would you say your percentage is for nearsighted kids? Like here in America, we have, I would say 80% nearsighted, maybe 20% is farsighted. What is your percentage that you've seen? Okay, no, I was saying that here in America, I would say 75 to 80% of the kids are nearsighted and the rest is farsighted. What would you say your percentage is, and from what you've seen and given glasses, what would you say is the percentage of nearsighted kids?
So here, the nearsighted is more compared to farsighted.
Right.
But
okay.
the percent
So
I don't have really.
Yeah.
I don't have
No. You don't have to worry about the percentage, but I just wanted to know where should I concentrate? What prescription should I concentrate on? Because I remember, you know, doing like how this country is a lot of nearsighted kids, and so I had a lot of nearsighted glasses. And I think I went to Jamaica, and their kids were mostly farsighted, and sometimes I didn't have enough of that prescription.
The school age children, we got most of them are hyperopic and astigmatism.
Ah, okay.
Yeah.
Okay.
Myopic it depends.
So myopia is not as high, you think?
Yeah, you can find them, but the more is the hyperopic, not a high power. It's from +1, +3, +2, etc. But myopic also, but it's not much as compared to hyperopia.
Very good. That's important to know. That's important to know. Okay.
Yeah.
Okay. That's key. So now I know what to tell them to concentrate on, what prescriptions to tell them to concentrate on.
The experience of the hospital, because we are dealing with the age of 60 to 16 years.
I think what I gathered, she said between 6 and 16.
Okay. Good. Okay.
So those are the school age kids, yeah. From 1st grade to 7th grade, yeah.
Okay. Very good. Very good.
But Dr. Vanessa?
Yes.
Maybe tomorrow I can look off it, then I'll send to you the clear percent.
Good. That would be great.
Yes.
That would be very good, because then when I speak to the people who donate the glasses, then I have some idea of what prescriptions that I need more of, because I already have to tell them we need smaller frames. So, okay, that would be great. If you can send that, I'll hold off on calling them until I get that information.
Okay.
Yeah.
And so will Redempta, will you put it in the WhatsApp, or how will she get it to her?
No, we're in the same group. Remember the vision group?
Oh, that's right. Yeah.
Yeah.
Okay. So put it in the vision group. Okay, great. Now, the only thing that I see, and I don't know yet, and I will speak with you, Dr. Harriet, after I speak to the people who donating the glasses, because usually they just give us what we call spherical prescriptions, meaning +1, +2, -1, -2. But you know, kids have astigmatism. Some people have astigmatism. They don't give us that. I'm going to ask them if they can, the primary prescriptions, you know, the astigmatism and axis 180 and axis 90. And at least that, you know, we may not get, if a kid have one axis 135 or 5 or 10, we're going to give them the closest that we have. But sometimes they won't give us anything with the astigmatism correction. Now, one mission trip I went to, the AIM, which is the people that we travel with, they actually paid for glasses to be made. Like, I have frames, so they didn't have to pay for the frames. So I donated the frames, but they paid for the prescription to be put in and the lab to do it. And the lab gave me a discount because you know, we were doing a mission trip. So it worked out to be like be $3 or $4 per glasses. That would be the only thing, but we'll know early. I'll be able to let you know early. And I will work with the numbers that Dr. Redempta gave me, and I will see how many of the people that donate glasses would give me. And I will still ask them if they can give me the correction for astigmatism. If they say no, then we may have to collect money to make up those extra, ones with the astigmatism correction.
Yes, and that's the part which, I'm sorry, that's the part which I was talking about. Once we know what exactly we're going to do, equipment we're going to do, we're going to say, okay, if we identify the kids who need the glasses, can you help us pay for the glasses? So we make a contribution and the hold on for that. When we get there and we identify the kids and they need those correction and we need to pay for it, then we can support that one. Yes, but that's
they wouldn't even have to pay for it there, because I would need to pay for it here before to bring down those glasses. So that means I would have to get the lab to make up.
Yes. Yes, we can do that. Yeah.
Okay. So, Dr. Redempta, I'll wait for that information first, and then we'll go from there. And then I'll keep you abreasted on what numbers did they say they would give us and what prescriptions of what we may need. Yeah, that's the best way to work it. Okay.
So we are in a group, I'm in a code vision group. So then if we give the update, it's going to be easier, all of us talking together. And then if there's nothing, yes, it'll be easier that way.
Very good.
If we can keep all this equipment in that list, that will be efficient so we can move forward. And definitely, and usually if people donate because of the vision, that funds is going to be there, Dr. Venessa. And then if we needed to get it before we go down to Tanzania, yes, it will be covered that way, yes.
Okay. Very good.
Okay, I know you guys, thank you very much. And
okay, you're quite welcome.
Both of you, I mean, I think this was very, very helpful. At least for me, to be able to see everything works out.
Yeah.
I'm happy to do that. Yeah, I am happy. Okay. Anything else final? Then you can let everybody go.
Yes, we want to get Dr. Redempta on the videos, and she has to, Dr. Redempta, Dr. Redempta.
Okay, so she can say hi. Can
wash a picture.
Oh, there is Dr. Venessa.
Yeah.
Redempta, can you come back on your video for a few seconds so we can take a picture and then we can go and finish the meeting.
Abasamu. There we go.
Okay, thank you very much. Yes.
All right, good picture, Venessa.
Yes, I know. Okay. Okay, bye guys. Thank you very much for coming. I will share the video so we finish. Yeah.
Okay. Very well.
Yes.
Bye.
Bye. Thank you guys. Be blessed. Sunday.
You too.
Okay,
bye.